me know.
Okay.
Uh, are you joining from? You're joining from. Uh, okay.
We're live, Anchor.
Okay.
Good evening, everybody. I'm Sayukta from Vistas Media, your host for today on Here All Issues Are Resolved YouTube channel. We go through a lot of look beautiful related issues as we grow up, but little do we realize that it's our hair that's our crowning glory. Our hair symbolizes health and personality. Gorgeous and healthy hair is an instant confidence boost. To guide us on how to take care of our crowning glory, that is our hairs, we have with us an expert dermatologist, Dr. Faizan Khan. He is a consultant dermatologist and cosmetologist from Mangalore. Dr. Faizan is at Shashirekha Multi-Speciality Hospital. He has completed his MBBS from Father Muller Medical College, Mangalore in 2015 and MD in Dermatology, Venereology and Leprosy from Yenepoya Medical College, Mangalore in 2020. He has completed fellowship in aesthetic medicine from ILA MED in collaboration and exchange with the University Medicine Greifswald, Germany. He is well versed in clinical dermatology as well as cosmetology. Expertise in treatment planning best suitable for each patient. He deals with any dermatological issue related to skin, hair, and nail. He is also a member of Indian Association of Dermatologists, Venereologists, and Leprologists. A very warm welcome to you, Dr. Faizan.
Thank you. Thank you so much for that warm introduction.
Dr. Faizan, today, as we are going to talk about hairs, the problem is that all of us do shed hairs, right? But the question is how much hair shedding is considered normal and when to be concerned. Okay, this is not normal. We should just go and get it checked.
Yeah, this is one question which I'm asked a lot actually. Normally, current generation, if I have to consider, even those 2 to 3 hair fall whenever it happens when we are combing, it creates a sort of tension and stress in our life. Oh, what is happening? Am I going bald? But that is not the case. Generally, what we say according to textbooks is that less than 100 hair fall per day is considered to be extremely normal. And if at all it is more than 100 or so, 80 to 100 or so, then it is considered to be that something is wrong within the body. So it has to be taken care by a dermatologist. But having said that, there are different situations and conditions wherein it's not just the hair fall which is of a concern, but also hair thinning. So the density of the hair also reduces. So even if the person does not reach to a level of hair fall, so the density reduction also is a major concern, and that itself should trigger a response where the person has to go to a dermatologist and get adequately diagnosed and then start the treatment. So all in all, I would say 180 to 100 hair is normal. Hair loss during combing or taking shower is normal, and it is not to be like it is not a sign of any worry. So a new hair is going to develop from where the hair has come out. So the hair follicle is intact, the hair shaft has fallen down.
Okay, so in case we see any abnormality in the hair shedding, pattern, we see thinning or partial, baldness, then definitely we should be alarmed and go and consult a doctor or a dermatologist, I should say. Now,
True.
doctor, what are the causes of hair loss?
The causes of hair fall, I would say everything and anything under the sun will be the
Okay.
cause of hair fall. So I would rather consider it as intrinsic internal causes and external causes. Okay.
Right.
The internal causes are the ones which are to be considered a lot. So these internal causes include hormonal imbalance, okay, thyroid abnormalities. So these things are the ones which will trigger hair fall. And in ladies, especially polycystic ovarian syndrome, that is PCOS, if it is there, if hormonal cycle changes are there. So these are the ones which will cause hair fall. And the other external causes, which if I have to come to the external causes, these are The first and the foremost and the very important one I stress a lot is stress factor. Okay, stress factor is directly proportional to the amount of hair fall. It is that significant matter actually. So other than stress, there is the external scalp infection may be as trivial as dandruff or as severe as some scalp infection. So that also can cause hair fall. And external what to say, beautification procedures, the parlor procedures, okay, if it is not done right, or if harsh chemicals are being used, so there will be chemical damage, mechanical damage. A simple example, using a straightener, okay, you are causing damage to the hair basically, so there's going to be mechanical damage. So these will be considered as external damage. And coming to physiological changes, and because of which hair fall will be there, the one most important aspect is pregnancy. So during pregnancy, it comes into the realm of hormonal changes. So hormones are a little different during the pregnancy, throughout the pregnancy. So once the baby is delivered, suddenly the hormone levels, the female estrogen and progesterone hormone levels go down. So as soon as it goes down, there is shedding of hair. So it is not that the hair sheds extremely, it is the extra hair which has been developed during the pregnancy which is going to shed. And this will continue for about 6 months to 1 year. So patients should never be alarmed with that. So these, on an overview, this is most of the important causes. And on top of it all, I kept this for the last as a last cause because everyone says this as a first cause. This is the most important one, and this is genetic. So something what we call as androgenetic alopecia. If hair
Mhm.
fall or hair loss runs in the family, it runs in the family, especially the genes travel from maternal uncles. So it's not just the mother and father. So it's a maternal uncle side genes. So these genes, when it is expressed, so there is going to be hair loss. It is hair loss is not a disease. I always say to my patients, hair loss is not a disease. It is a situation. As humans, we do not like it, so if we liked it, then we would go ahead with it. So if we do not like it, so we want to slow the progression, rather try to treat the hair fall.
Right. You very rightly said that it itself is not a disease, but it can be a situation where an underlying medical condition could be responsible for it, right, doctor?
Yes.
So many a times, what happens, even if we ignore hair loss, maybe we are actually ignoring a medical condition which is going on. So it's always advisable that we should go and consult a doctor like you, doctor, right?
True. The diagnosis is very important, and self-medication or self-diagnosis treats to various problems again. So the diagnosis, the underlying cause, all have to be evaluated and rightly treated. So there is no point in treating hair externally when the problem is within. So some
Right.
thyroid abnormality may it be. So that way.
But normally, what we do, I'm sure you will also agree to that. Whenever we see abnormal hair loss or hair fall, we'll first go to the run for the kitchen for some, quick fixes, home remedies, etc. Or we'll
True.
go and consult a chemist rather than going to a doctor and ask for an, over-the-counter solution, some tonic, spray, oil, whatever. And eventually, we keep on delaying and restrict ourselves from going to the right person, which is a qualified dermatologist in this case.
True.
Now, what are the side effects or disadvantages of going for home remedies or wasting our time over the counter medicines?
Okay, so I let me start in a very simple manner. Hair loss is a very complicated phenomenon. So it is not just that, okay, I have hair loss, I will take something for 5 days or 7 days, and then okay, I have good hair. So normally, without any problem, without any underlying situation, if a person wants to have that bald look, so they go to a hairdresser and then they shave off the hair, they
Right.
shave off the head. So it roughly takes about 4 to 5 months to develop that particular hair back. So that much amount of time is minimum required to even notice response when we start treating. So if someone expects it to happen over a week, it is not going to. frankly speaking. Okay, so that is one major, it's not drawback, it is a natural phenomenon. It's just that we do not have patience as humans, so we should have more patience. The first and foremost thing what you told, the home ingredients whatever we use, first of all, these chemical agents are not supposed to be applied on top of the skin. Why? Because these are supposed to be consumed. Okay, so the active agents, rather than helping you, will cause destruction or damage to the skin of the scalp. Okay, rather than you getting more hair, you will start losing more hair. The scalp health, not just the hair health, the scalp health also goes down. There is a particular pH balance of our skin. So that pH balance, the acidic level of the skin goes haywire. And when that happens, automatically new infections, new fungal growth, and all those things will start appearing. And again, it will cause flaky discharge and all those things, and then cause flaky dandruff basically. And that will again in turn cause hair fall. So it is like a cycle. So once we want to treat this, and it is again leading to more hair fall. And second thing is the over the counter medications. Over the counter medications, half the time, that's what a person has hair fall and is going for a treatment by going to a chemist. They are missing out in this chain. They are missing out on the diagnosis component.
Right.
So there is no diagnosis. There is a symptom and there is treatment. If there is no right diagnosis, then the treatment also changes. So without any knowledge of what diagnosis it is or the science behind it, if over-the-counter medications are used, two things can happen. One thing, amazing result will happen. Amazing results can be there. Luck factor, okay. But this amazing result is going to go in the next hair cycle. See, our hair cycle is almost for about 3 to 4 months. Okay, one hair cycle. Consider 3 to 4 months. So in a year, somewhere about 3 to 4 hair cycles will be there. Okay, so this hair cycle, whenever we are using over-the-counter products which are not harmful, those kind of products, one hair cycle can be maintained. But underlying diagnosis, if it is not corrected, okay, underlying illness, if it is not corrected, it is going to backfire. So you are going to stop that medication because the chemist doesn't know how much to apply and how much to take or how long to take. You're not counseled for how long to take. So you're going to stop that and you're going to develop reverse hair fall. Second thing which can happen, the medication is absolutely and completely wrong. Okay. So that's when the side effects kick in. The side effects, the overdose of this medication can cause severe hair fall again. So these are the situations where what we tell, diagnosis becomes very important and consultation for hair fall becomes very important.
Right. And doctor, whenever we talk about the management of hair loss, we hear about medical management. We also hear about non-surgical and surgical management of hair loss. We would like to understand what these are one by one. So first of all, would you like to talk about medical management of hair loss?
Yes, definitely. So bottom line, if I want to say, many times many people think hair transplant is an ultimate answer for hair loss. Okay, hair transplant is not an ultimate answer. Uh, I'll just give one small example. Consider 1 into 1 centimeter area on your scalp. Okay, you imagine a normal person if he's or she's having 100 hair in 1 into 1 centimeter area. So there is hair loss because of any of the reasons which I mentioned, may it be intrinsic or extrinsic factor. So from 100, it is going to become 80 hair. Okay, so now it is 80 hair on the scalp, and those 20 hair are not there. And because of the nutritional deficiency, because of the underlying condition, not just the hair fall has happened, those 80 hair are also unhealthy and they are thinning out. So your scalp is visible. You feel there is hair loss, but your the hair thinning has happened. So now the medical management, which is with the one which you asked, medical management helps in reversing this thinning of the hair. Our main intention with medical management is not the development of those 20 lost hair. The main treatment and the benefit of this medical management is to make those 80 hair healthy so that it will not go from 80 hair to 60 hair again.
Right.
Okay. Surgical like the hair transplant option comes later in the line of treatment when we want to put those extra 20 hair.
Hmm.
That is only supposed to be done after we manage the 80 hair. So medical management is of utmost important, and it is like a elixir which cannot be divided. Even after hair transplant, medical management has to continue. Like I said, hair fall or hair loss is not a disease. So if
Hmm.
anyone is expecting that, we need to take medications or apply serums for some time and leave it. Okay, it is not going to happen. We'll have to do it for a longer time. Okay, so that is how medical management, and again medical management is divided into growth factor management and also reversal technique with minoxidil. Okay, topical finasteride. So many topical agents are available as of now in this generation. So
Mhm.
if we feel, if it is not a genetic influence, if there's no genetic influence, and only what to say, underlying, uh, someone is undergoing having low hemoglobin, so a person
Mhm.
has anemia, a person has thyroid dysfunction, and the growth factors are not reaching the hair. So in this situation, we definitely use growth factor serums.
Doctor, as you mentioned about, nutritional deficiency, etc., a question just arrived, and the question is that, because nowadays people are so aware, so much information is there. People know that if hair is falling or I'm having hair loss, that means I'm low on, maybe iron, or I'm low on zinc, or I'm low on biotin, etc., etc. I'll go myself and buy these supplements. I will never go to a doctor to ask whether I have these deficiencies or not. I'll never go and get a lab test done. I'll just get these supplements and keep on popping them. I'm sure you get a number of patients every day who
Sure.
does the same. Now,
Yeah.
is it a good practice or a healthy practice, or what should be the right thing to do?
Um, in this is a generation where everyone wants to be on the tip of their toes and just keep popping pills.
Mhm.
You're right, you're rightly saying, many a times we get these patients who come out and tell us that I have taken biotin for so long, so and still I have hair loss. So what is
Mhm.
this? I think biotin is not working for me. True, biotin is not working for you, bottom line. Two main reasons are there. Hair requires somewhere about 25 to 30 growth factors on a daily basis. Okay, and
Okay.
this 25 to 30 hair, what to say, growth factors include not just vitamins. It
Mhm.
also includes something called as minerals and trace elements also. What biotin is one of the component of vitamin B. So there are vitamin B complex, and one of them is biotin. So there is vitamin A, vitamin B, vitamin E, vitamin D. So all the vitamins are required, and along with that, minerals and minerals and trace elements like iron, selenium, magnesium, manganese. So many components are there which are required. So our hair requires multiple nutrient factors, all of which are present in our body. Okay, so imagine a person has low hemoglobin. Hemoglobin, major component of hemoglobin is iron. So when we are consuming iron, so iron goes and develops more hemoglobin rather than going to the scalp and give more hair. So we need to diagnose whether hemoglobin is less or not. Simply, if
Right.
we keep popping in iron tablets, there is no point in, there is no hair growth as such. And second thing, all nutraceuticals are not meant for hair, so they are meant for something else also. Why I'm telling this is, majority of the times whatever over the counter nutraceuticals are there, whatever over the counter vitamin tablets are there, have a different molecular weight. Our required daily allowance, that is RDA, of these vitamins is a specific thing. So when that is not correct, so then it is just, you're taking it in and it is going out, or it is causing side effects. Many a times accumulation of these particular vitamins over the counter, whenever they keep taking, cause side effects, and that itself will cause hair fall also. So a package of vitamins, minerals, trace elements all have to be in a particular amount, and that has to be taken.
Right. So the bottom line is, don't be a doctor yourself. Go and consult a right
True.
person again, which is a qualified dermatologist. Now, doctor, we have already talked about the medical management of hair loss. Now, would you like to shed some more light on surgical and non-surgical management of hair loss?
Yeah, so the second component of hair loss treatment after medical management is the procedural management. So the procedural management includes something called as PRP therapy. So this is called as platelet-rich plasma therapy. This was the first one which was initiated, and further on, as and when generation progressed, technology progressed, now there is something called as GFC kits available, growth factor concentrate kits. All in all works the same mechanism. So PRP is a situation, is a procedure where we are going to take out patient's own blood, a little 10 ml to 15 ml, and then purify it and separate out the growth factors, and then inject it directly to the scalp. All in all, there are 5 to 6 treatments in this world for hair loss. One is the medical management, and this medical management can be in the form of topical sprays, so that local effect is there, and in the form of oral tablets, so that it goes into the tummy and then into the blood and then into the scalp. Okay, and now what we consider is the best source of growth factors is not with the chemist, it's in your body itself. That is the reason we are doing this PRP therapy. We take out your blood, purify it, and separate these growth factors, and we inject it locally on the scalp. Like how whenever we fall, we have a scratch mark, it will heal by itself. So our body has a mechanism wherein all the platelets will rupture and growth factors will be released, and that is how our wound heals. So the same way, whenever we prick with the syringes, which are tiny syringes, almost completely painless. So when we prick with the syringes, there will be wound created, and to close those wounds, growth factors will be released. And once these growth factors are released, it will be taken up in the hair root. So this, when it happens, body gets completely, like, there will be a changeover. So on and on, monthly once, when we keep doing this PRP treatment, so automatically the freshness and the thickness of the hair increases, and whichever follicles are, like, at the end stage will start developing, like all those baby hairs we start developing. Now, as the technology increased, growth factor kits came into picture, where more better penetrability of the growth factors from our blood is present, and it is a little less painful, and that also can be considered. This is the one of the procedural component, and the next procedural component is something called as hair threads. So there are this absorbable suture materials called as threads, which will be placed on the in the scalp, not on the scalp. It's placed in the scalp. It is almost again a completely painless procedure type of procedure. Somewhere about 15 to 20 threads we place underneath the scalp, and this will initiate the growth phase of the hair. So the growth phase of the hair, when it is initiated, again, there is going to be more hair growth. So this is another thing. And the last component in the procedures is something which is called as low level laser therapy. So this is a low level red laser therapy, where it comes in the form of helmet, it comes in the form of comb, it comes in the form of stand lights. Okay, so all these components will increase the blood circulation to the scalp, and along with this, if we do micro needling, okay, so with small needles, either by derma roller or derma pen or some technological device like micro needling technology, so when we do that, all this will lead to extra hair growth or hair maintenance of hair. So this is the procedural component. And coming to the surgical component, so everything done right, the medical management and the procedural management, you have adequate good number of hair now, and your hair thinning is reversed. That is when we go into the surgical management to give those extra hair. Okay, and especially in the pattern baldness, we do fill in the sides, especially, and in the vertex area. So surgical management, again, this is called as a hair transplantation. There are two types of surgical management. So that is for FUT and FUE, follicular unit transplantation and follicular unit extraction. Okay, so this is a technique in which FUE is a technique in which individual hair follicles are extracted from behind and then it is placed in the front area where the hair loss is there. So here it is basically the scarring is a little less, and the follicles which are removed, which can be covered by the other hair, so there is no absolutely no scarring, and the person who is looking at you or you yourself, when you're trying to notice from where the hair follicle is taken, you will not be able to. So but the duration of the procedure is long, and not many hair follicles can be taken out. Everything cannot be taken out from back because we'll go bald in the back. And
Right.
the second option is FUT. In this, a section of hair follicles are taken from the scalp behind. A patch of hair follicles are taken. Scalp tissue is taken, and then it is individually cut, and individually hair follicle is extracted from that, and then and then placed here. And the defect here behind will be sutured, and one scar line will be present. So this is the surgical component. And now currently in this generation, newer technology, artificial intelligence system also has come, where we have to just there are devices, technology, machines which will identify where the hair loss is and what pattern it is, and it will extract by its own and place it by its own. So it is very minimally invasive,
Mhm.
yet to boom in India, but still, yes, there are centers where it is already available.
Okay,
So
so you
this is
have
the
very well
overview.
yes, so you have very well explained the medical, surgical, and non-surgical management of hair loss. We'll quickly take some of our viewers' questions, and then we'll
All right.
move forward. So Prem Baghel is here asking, okay, am I losing more hair than I should be, or do we lose more hairs when we get older?
That is a very subjective question, actually. There are patients of mine who are 18 years, 19 years, and have almost grade 5 alopecia. That is almost bald. Okay, so genetic influence is a very important factor. Some people go bald in 35s, some people in 45s, and some in 20s itself. Okay, so underlying condition, underlying situation has to be assessed. But yes, as and when we are aging, our hair also ages. So we will lose hair as and when our age is progressing. But if the rate of loss of hair is more than our aging itself, then yes, you will have to consult a dermatologist, and adequate treatment has to be started so that we can maintain and prolong those hair. If possibly 35 is the age group where you are losing more hair, we want to extend it to until 40 at least, so that those extra 5 years you'll get with hair. So I think yes.
Yes, right. Deepak Saxena is asking, does by using straightener we are also damaging our hair? And nowadays, doctor, as you also know that, many few are there who have virgin hairs. We either have, color on our hair, or some treatment, salon-based treatments, or some chemical or straighteners or blow dryers. They are integral part of our hair care
Yes.
or hair routine these days. How damaging these are?
uh, See, one thing I will tell is that we cannot stop living our life just because
Mm.
there is some damage to hair also. Okay, so we have to go through this phase where you have to get your hair straightened or some parlor procedures. I always tell, leave at least 2 to 3 centimeters from the scalp and then do these procedures. Don't
Mm.
damage that hair root also
Right.
till the
Yeah.
tip. Okay, so the hair shaft is all yours. You go bonkers, you do anything to the hair shaft. Okay, there are these hair botox in salons now. It's not actually botox, but it's a conditioning treatments
Mm.
where, and there's I think you would be very familiar with keratin treatment. So
Right.
all these things can be done, but at least 3 to 4 centimeter of the hair from the scalp level, you can
Right.
stop there, and then from there onwards, you can just start the hair treatments. Straightener is one thing. I always have a big issue with that because it is going to cause heat damage, and heat damage is one of the very bad type of damage in hair. Okay, especially for the hair shaft. We get, there are a particular group of disorders called as hair shaft disorders. like how our bones break when we fall from cycle or bike. So same way, even the hair breaks. There are these hair fractures, okay? And it might not happen to everyone, or it might not happen every time you're straightening your hair, but it can happen once in a while, or probably once in those 10 times you're doing. So you can't obviously completely not do it, but in case if there's a situation where you cannot do it and you need not do it, then refrain from it. If at all you have to do, leave a space of 4 to 5 centimeters from the scalp and then do it just for the probably the ends or probably the mid portion of the hair.
Okay, fair enough. Dolly Saxena is asking, okay, a similar question. What is the best way to prevent hair damage?
Best way to prevent hair damage is stop taking stress, eat healthy. Okay, kidding aside, see, conditioners, using conditioners is one thing which I personally tell all my patients is one of the best things you can do to your hair, because
Mhm.
everyone washes their hair, but
Hmm.
after washing you'll have to take care of the dryness of the hair shaft. All of us and all of the doctors and all of the patients are concentrating the hair root, so nobody is taking care of the hair which is outside. Okay, so
Hmm.
every time you apply a shampoo and finish the hair, giving a bath to the hair, and then you have to apply conditioner. That is an essential component. And good uh, dry fruits and vegetables and mixture of fruits, all these things will go a long way in
Right.
maintaining the hair.
Now, as you mentioned, conditioner, because many people say that whenever they wash their hairs, they tend to lose a lot of hair. They see a lot of hair, lying down. Now, with conditioner, the situation gets worse for them because they see a lot of hair falling. Now, what's the truth? Because as you said initially, hair shedding is quite natural. Every day we do lose 80, 200 or whatever number of hairs. So, is shedding hairs during hair wash or conditioning should also be considered normal?
Yeah, I'll tell you. See, normally on a scalp at any given point, okay, there is a growth phase. Some hair will be there which are in the growth phase. Some hair will be, and majority of the hair will be in the resting phase. Okay, they are just there. Okay, they do not fall, they do not grow. So they are just there. And the third phase is something called as catagen phase, which is the shedding phase. Okay, each hair, mind you, each hair has to go through all these stages. One which is in the hair growth phase will become enter the resting phase, and then after certain amount of rest it will go into the shedding phase. At a given point of time, at least about 13 to 15% of our hair will be in the shedding phase. Okay, so that is going to shed off that one particular hair. Imagine one particular hair is going to shed off no matter what you do. You take bath, you don't take bath, you apply conditioner, you don't apply conditioner, you eat food, don't eat food, it is going to fall.
Okay.
Now it is in the tip of the it is in the verge of falling, and you comb with your, you like, craft with your comb, and now that hair comes out very easily into your comb.
Hmm.
That is not hair loss. That is natural process where it was supposed to go out. Same
Right.
thing happens when you are washing our hair or applying conditioner as well. So certain amount of hair fall is normal. But when you notice severely every single day, there is a loss of somewhere about 60 to 80, 80 to 100 type of hair. And once after the wash, you're going back and you're combing again, there so much loss. You sleep and you get up on the pillow, there is so much hair loss. And you're like, cleaning your room and you can only find hair. This is a situation where it is abnormal. So that is when you need to be alarmed.
Okay. And we would also like to talk about dandruff, doctor, because again, dandruff is very common in our society. People get dandruff. And also, with dandruff, I would also like to you to shed some light over the use of oil on our scalp, because, with more dandruff, we tend to apply more oil and it makes the situation even more worse. So, what's
Yeah.
the right thing to do?
Okay. So the simple way of answering this is dandruff is normal for every person. Okay. So it is not, again, it is not a disease. Okay. Everyone, each one of us have a fungal component living with us on the scalp. Okay, so they are the normal commensals on our scalp. We do have this group of fungus called as Malassezia fungus. Okay, so they are there for our normal scalp health. Okay, so now what happens whenever, see, you should understand like how we take care of our face. That is because the facial skin is here. So same way there is skin over here also. The scalp skin also produces some amount of oil, also has some amount of dirt, everything. So it has to be taken care of. If not, what happens is oil secretion increases, and this will be a food material for this fungal component, and it will start thriving, and it will start increasing in its it will start expanding. Basically, it will start increasing the horizons of their kingdom, basically. And when that happens, body senses that it is happening. So the only way body can eliminate it is by producing more number of layers of scalp tissue, like the skin. So the more number of dead layers will be produced, so that it is eliminated. Now, since the scalp is greasy and oily, so it will get stuck on the scalp. So the dandruff flake, what is taken out is a mixture of fungal component, the scalp secretions, the excess skin tissue which is coming out because body wants to eliminate dandruff. Okay, all this will come and anchor the hair like this, because there is no space for it. So it will anchor the hair like this on the scalp. Now you will take the comb, and many of you guys have the habit of brushing your comb on top and removing those dandruff flakes.
Yes.
So when that happens, the dandruff which is stuck to the hair will come out with the hair. Again, hair loss. Okay, so this is a common phenomenon. And many a times, whenever there is dandruff, so everyone tends to apply hair oil. So consider this as a scalp tissue and this as a flaky dandruff. So it is attached to one area and the dandruff is flaky, which is, you can see it in the mirror. Okay. So now you apply oil and you will feel there is relief in the dandruff issue. What exactly is happening there is, when you are applying oil, this dandruff, the flake will attach back to the scalp, because oil is a sticky substance.
Right.
Okay, so it will attach back to the scalp and you will be like, okay, oil has treated my dandruff. But after application of oil, the oil will be absorbed and oil will be evaporated and everything is done. Again, the dandruff will flake out. Okay. Essentially, what problem happening here is, I already told you the fungal component thrives on oil secretion of the scalp. Now you are giving it more food by applying more oil. So it will thrive more. So second time the dandruff will become more thicker and more dandruff will appear. Okay. So bottom line, I know I will get many haters for this, but oil does not help hair growth. Oil does not help in removing dandruff. If your scalp is oily, greasy, you don't need to apply oil to your scalp. But oil is good for your hair, not scalp. Okay. So if at all you want, like how we apply moisturizers to our skin for the dry skin, you need to apply oil to your hair so that your hair is healthy, the shaft of the hair, and not the scalp. A person who has dry scalp and no dandruff flakes or something like that can afford to apply oil.
Okay, fair enough. We'll take one more question before we sum up the session. It's by Ramachandra BG. My brother-in-law was taking treatment for 1 year, and he stopped. And now, after 2 years, he has only 30% hair. And due to hair loss, he's 35 years of old age, and he's unmarried. So he's really bothered about.
So, considering the situation, I think what he must have been going through is something called as androgenetic alopecia. Okay.
Okay.
So, like I said, how our age only progresses one way. Like we are 30. If someone is 35 now and he'll become 36 next year, you cannot become 35 again. So same way, the genetic makeup of the scalp or the hair, especially in this aspect for the males or male person, what happens is the hair follicles age faster. than it is supposed to be. So the thinning of hair happens. Classical example of what the person is doing, whatever you mentioned in the question, many a times people take treatment for about 6 months to 1 year and then stop the treatment.
Mm.
Now, if you stop the treatment, the genetic mechanism is going to kick back again and continue aging. So there is
Right.
nothing. You have stopped the only thing which was stopping your hair loss. So automatically again hair fall happens. So like I said, in 1 year, probably 3 to 4 hair cycles happen. So when the person was taking medications or the treatment for 1 year, 3 to 4 hair cycles were maintained. Once
Mm.
that happened, once that stopped, there is no influence on the scalp now. There is no reversal of thinning. So automatically thinning continues. Automatically hair loss continues. It is simple, like how we get up in the morning and brush our teeth. Nobody tells us we have brushed for 30 years. Why should we brush again? So
Mm.
same way, once you start treatment, especially for androgenetic alopecia, think of it as that in that
Right.
manner, and you can continue. And everyone has a different goal. Someone
Mm.
wants hair until at least till they're 40. So you have to take treatment until 40. So after that, if you're not bothered, there are many other things if you're stressed in life. So you can concentrate on that and not this. So a proper
Exactly.
counseling and consultation and treatment is definitely required. And I think counseling will go more do more benefit than just treatment in this case.
Fair enough. And Dr. Faizan, before we wind up the whole session, any take-home message or important tips for healthy hair?
Yes. Take home message important tips as such is do not diagnose yourself. Do not go to chemist and try over the counter things. The initial few months or years of hair loss is very, very important for us also, like as doctors. Why? Because this is the situation where we can give back good results to you. Like, if it is in the later stage, even we have limitations because that as of now, the current technology or current situation, the science, we can do only so much. So the more earlier it is, the more better. So many a times, many people procrastinate consulting a dermatologist for their hair issue, and that they will repent for that only after 2 or 3 years extra after hair loss. So do not come in the later stages, come in the early stages. And second thing, again, over the counter, do not try those onion hair oil, that hair oil. It is only going to worsen the situation and wasting your money on those things. So each month you can add up that money itself on the actual treatment and get benefit out of it.
Right.
So yeah, that is it.
Thank you so very much, Dr. Faizan. It was wonderful talking to you, and thank you for your valuable guidance and advice on how to keep our hair healthy. Because, especially, in the current scenario, where apart from our environmental and genetic factors, the increasing levels of pollution and stress, they're actually
Yeah.
taking a toll. And as you said, yeah, stress is like a vicious circle. Stress will lead to hair loss, hair loss will lead to more of stress.
True.
So thank you so very much, and it was a pleasure having you for this session.
Thank you so much for having me. I enjoyed it a lot. Thank you.
And I'm sure your guidance will help our viewers. And viewers, if you want to get personal consultation from Dr. Faizan, you can consult him at Shashi Rekha Multi Speciality Hospital. So thank you once again, Dr. Faizan, and thank you, our viewers, for your active participation and for watching the show. And for more information on how to get all your hair issues resolved, do like and subscribe to